How's the Startup Health Festival going for you?
Oh, it's my first. It's extremely exciting.
Very nice, very nice. So you are with Rezilient. You're a tech-enabled support service working with patients with dementia.
Right.
Which is very exciting, and we'll get into all of that, how that works. But first, let's start with Rezilient's Health Moonshot. What's that big, audacious goal you're shooting for at Rezilient?
So our focus is actually on the family caregiver.
Okay.
And our goal is to ensure that chronically ill people are taken care of at home by supported caregivers with a home-based care system. That would be our moonshot.
So you're caring for the caregivers.
Correct.
Very interesting.
Yeah, our whole focus is if the caregiver's not in good shape, they're not going to be able to do their job well as a caregiver and take care of the person who has obviously needs that care.
Right. So you're helping the caregivers remain resilient.
Right. And it's assumed at this point in time that they know how to do this.
Yeah.
But the reality is it's a very challenging journey.
Yeah.
And actually, if we were looking philosophically at challenge, which is really what this is about, we want to make people understand that challenge could actually be an opportunity to fulfill and reach actually even a level of happiness, dare I say it. So we live in a world today where trauma and challenge is perceived as an anomaly, when in fact we live in a world where nearly everyone faces one form of challenge or another. And why aren't we given the tools and the mindset to look at this in a very different way? And why is it only perceived as something bad? And why do we avoid everything that is hard when we know that those things actually can be pivotal for change in a very positive way?
Yeah, can actually be the thing in your life that causes you to shift or to grow.
Well, that's what happened to me.
Okay.
I'm a family caregiver. I have a child who has special needs.
Oh, wow.
And, you know, I went on that journey and sort of after a few years sort of saw that I wasn't coping well. And at that point was wondering, is miserable now my new normal? And that didn't make sense. So I went on my own journey to sort of find a new way, came out of that and then learned and saw I'm happier now than I ever was, and that's not what I was told, or that's certainly not what I expected. How can I actually help other people experience that and change their mindset? So that's really where it all came from.
Wow, wow. Okay, so tell me now, let's talk about the product itself.
Yeah.
How do you do that? Because that's a big ask.
So we're actually doing a behavior change coaching methodology that uses an actual human coach. We have metrics that assess the caregiver through self-reported metrics that they actually provide data about themselves that enable us to see whether a caregiver is reaching what we call role overload. And role overload, we view caregiving, it's a role like any other role, and we want you to understand that this is a role, and what happens with caregiving is that it's very frequently perceived as, which it is, something very personal and also emotional.
Yeah.
And caregiving doesn't have any boundaries, it's very unpredictable and chaotic, and we want to help you stay on track, actually, so that your whole life doesn't fall apart, and maintain your work-life balance and not burn out.
Yeah, it's seen more as a burden than a role, really.
Right.
Interesting.
And so, you know, if I was to say to you, you know, you're about to now have to take care of someone for the next 10 years who's going to become progressively more ill, what do you need actually to do that job well?
Yeah.
I'm sure you'd have some answers.
So what's the thing in 2020 that you're most excited about for
Our
Rezilient?
pilot, it's going live. We're starting to test with caregivers.
When's it going live?
Next month.
Next month.
Yeah.
Congratulations.
Thank you. It's a huge achievement.
Yes, awesome.
Yeah, very excited about that.
All right.
Yeah.
And then beyond that, what's the benchmark that you're hoping to hit for the year?
So, you know, our main focus will be on engagement with the caregivers.
Okay.
That's absolutely where that's a critical piece for us. And then, of course, receiving actual outcomes and improving quality of life, enabling them to be more productive in the workforce, you know, enabling them to take care of the patient in the home longer.
Awesome.
Those are sort of outcomes that we'll be looking for.
Awesome, Tanya. Well, thanks for coming by. It's the time we have. Thanks for the work that you're doing.